The surgical treatment of humerus fractures is a little bit contentious. Up until the mid to late 80s, the vast majority of these were treated non-operatively, and still a lot of people use functional bracing as their primary mode of treating humerus fractures. And in fact, most of the patients that I see, I try to recommend non-operative management before deciding to fix it. In this particular case, the patient was obese, and she had a functional problem. With her lower extremity, she had ataxia from gentamicin toxicity years ago, and so she really needs her upper extremities. So given the pain control issues that she had and difficulty with bracing, she elected to have this fixed. The other kind of thing that's evolved over time is the thinking of the radial nerve. So she had a radial nerve palsy. There was a time when people used radial nerve palsy as an indication for surgery. However, now I think that's pretty much irrelevant, except in the case of an open fracture. The big indication for me is an open fracture. So all open fractures I'm going to treat operatively. I think if you're there and you're debriding it, then you should stabilize it at the same time. Pathologic fractures, again, are a time when fixing humerus makes more sense. And then the other big indication for me is polytrauma. So a lot of times people have other extremity injuries, they need to use their arm, and especially in a young fit person with good bone quality, you're going to let them be full weight bearing after fixing their humerus, and so it allows them to get up and walk. So polytrauma, open fractures, and pathologic fractures are my three main indications.